Another edition of What's the Message, where we bring you the hope in the headlines. As always, I am your host, Claudia Allen. And of course, I am with my commander-in-chief, my editor-in-chief, my partner in crime, the lady who makes everything happen, the one and only Carmela Monk Crawford. And I am telling you guys, I am so excited and so honored to have the conversation that we are going to be having this morning. We are graced to have the one and only Dr. Prudence Pollard of the illustrious Oakwood University. She is the faculty. She is the vice president of faculty development and a professor of management there. And we are also grateful to have Ursula Roberts Allen, who is a director of nursing services for the OMV Medical Incorporation. And she actually just went viral. She did a Facebook Live talking about just the topic that we are going to discuss this morning. And so I'd like for you to just get a snippet of what she shared on her Facebook Live. All right, Robert, let them see it.
I work in the healthcare field right here in the Washington, D.C. area. And I'm seeing a trend that I want to bring to the attention of my fellow Black Americans, Black Caribbean folks, Blacks of any kind or shape, wherever you come from, that I think you all need to be aware of. That is, for folks who are showing symptoms of COVID-19, our symptoms as Blacks are different. You don't have a cough, you don't have a temperature, yet our folks are dying at a higher rate than any other nationality or group. And that is because instead of a fever and a cough, what our folks are showing up with is what we in healthcare call malaise, or you just don't feel right. And on top of that, what happens is you start having either pain in an extremity or you just start feeling a little winded. Guess what? If this is happening to you, you need not to go lay down. The clock is ticking. This coronavirus brings on bleeding inside our bodies, whether it's in our extremities, in our hearts, or in our lungs, causing blood clots. And that's what's killing our Black folks.
I'm telling you, Miss Ursula has so much more to share with us this morning. I am so excited because we have both of these amazing educated Black women on the front lines of public health. And so I am so excited for you to meet them, for you to hear from them, because I'm telling you, we need to know as Black people, and as Ms. Ursula said in her video, it doesn't matter from where you've come, if you're from the continent, if you're from the islands, if you're right here in the States, you're Black is irrelevant. COVID is hitting and impacting all of us in very interesting and important ways. And so I am so excited for us to get the information that we need so that we can continue to protect our fathers, our brothers, our sisters, our cousins, because that's what is important right now in the midst of this pandemic. All right. So as usual, I'm excited. Carmela, what is going on? Catch us up.
My goodness. I wish I knew what was going on. That's why we have to have a podcast like this so that we can talk to the people who are on the front lines, who know what's happening. You know, a couple of weeks ago, we were discussing the whole idea of COVID-19 and it affecting communities of color, in particular, Black neighborhoods and communities at such a disparate rate. And you know, that is my thing. I'm already watching the ways in which the criminal justice system it's our community, the ways in which our people are subject to different social determinants, if you could say it like that, you know. And so for me, we were already lamenting the fact that in Chicago and in New Orleans and in parts of Georgia and in Detroit, Black people were being hit harder because of this virus, and not being able to, because of some of the instances where, you know, people are moving in and around, they're still working in a service, and some people say a mission and missionary type of work, line of work, that they're always around people and cannot necessarily socially distance or social distance themselves from other people. And so then the headlines started coming out in the last week or two that were very frightening. One in particular, I was reading Vox. You should go ahead and look on Vox.com and Forbes. These are some interesting outlets to relay this health information. But I thought it was interesting to go back and read these in-depth stories of what people are finding. And what scared me to death was the idea that, you know, there was one particularly descriptive scenario in which the doctor was reporting how he was operating on a stroke, which I'm not a medical person, Miss Ursula. She's looking at me like, my goodness. He's operating and he's watching blood clots form before his eyes. And they were not responsive to clotting medications and drugs. Then I get in my messenger, in my inbox, Miss Ursula's video, which when I viewed it last week had 1.7 million views. Absolutely. And to come to find out, this Miss Ursula, you know how people talk about 6 degrees of separation, she was just a phone call away, and we were able to find her. So I'm happy that you're here today, because I want to get to, you know, for me, it's a big idea and a big service to be able to let people know this is what's happening. And when you talk about the fact that this is affecting Black people differently, this is something that we really need to discuss. And so I want to ask from you straight up, what have you seen and how did you see it? What did you observe yourself?
Well, for one, right off the top, with our Caucasian brothers and sisters, they're tending to run a temperature and have a cough. And when you listen to the news and if you've tried to get tested for COVID-19, you will understand that unless you have a temperature over 101 and a cough, you don't even qualify. Yep. So our folks weren't getting tested because at least 85% of them did not have a temperature. Yep. No temperature. What they were reporting was that, you know, I just don't feel right. I've got what we in the healthcare community call malaise. I feel like I'm coming down with something. I just don't feel well. And so they were told, oh, just stay at home and self-quarantine. We'll, you know, figure out later. If you start running a temp, then call your doctor. On most, about 50% of these folks, it's too late by the time they call the doctor. And I think what really got me going was I had a few close friends who had family members who died, and they never got tested because that's exactly what they were told to do. And a very good friend of mine, Miss Olga Roberts,
I'm sorry, you're saying they were told to go home and rest.
Right.
And not go to the hospital. Okay, go ahead.
So they didn't qualify for a test. So none of them, of about 8 people, none of them were tested. And one in particular, she was sent home on quarantine because she was around an infected patient. So as a healthcare worker, I said, did you get tested? And she's like, no, but you know, I'm feeling much better. And I'm supposed to go back on Monday to go get tested. Well, on Tuesday, she calls me and she's like, Ursula, you know what? You almost heard that I died. And I'm like, what are you talking about? She said, I was good Friday when I spoke with you, but Sabbath morning I woke up and I couldn't catch my breath. And I'm like, what was wrong? She said, well, I was trying to talk with my sister-in-law who's a nurse, and I guess I sounded so bad, she hung up the phone and called 911. They got there, her heart rate was 145. So they couldn't even move her until they stabilized her heart rate. when they got her to the hospital, she had 6 blood clots in her lung. And that just made me angry. So I have to really give kudos to Pastor Graham, because I was on his youth meeting and he's like, Ursula, he usually picks on me. And I just wasn't my usual talkative self. And he's like, what's on your mind? I said, you don't want to know what's on my mind. He's like, yeah, I do. And so I let him have it. I told him exactly what was on my mind. And when I got done, everybody started clapping. I'm like, Ursula, we've never heard that. Nobody's ever said that.
Right.
I said, well, you're not going to hear it, because as the doctor from PG Hospital told my friend Olga, that, we've been trying to get the CDC to put this out because we're seeing it, but they tell us we need to have X amount of autopsies and they're investigating, but we keep seeing it and we're telling them that's what we're seeing it. So I called to another friend who is in charge down at Howard University Hospital, and they were saying the same thing. So I called over to Holy Cross Hospital, and they were seeing the same thing.
Wow.
So my question was, if everybody's seeing the same thing, why are we still talking only about a temperature and a cough?
Yeah.
And so, I'm sorry, my light. So with that being said, we really had to figure out how to get the word out. And so Pastor Graham's thing put it on Facebook.
Let me say something real quick. You, Pastor Graham, you're talking about Pastor Paul Graham?
Pastor Patrick Graham.
Patrick Graham, who is a youth leader in this area of the country for a region
youth
called
director for Allegheny East Conference.
Yes.
Yeah.
Well, let me just ask you then. And so it sounds to me, because I'm asking you, what did you see and what did you hear? And it sounds like you were doing your own groundwork. Is part of the reason why we're not hearing these things reported because this is, number one, so new, and it is developing on the ground. And so it's hard to, I don't know, is there a reluctance then to share this information that is not a part of a controlled study or something like that?
Well, I think part of that is true, but I also think it would mean that it would exponentially increase the amount of people who need to be tested.
Okay.
And we will tell you that right now, if you don't have those defined characteristics, they're not testing. Even if you're a healthcare worker, they're not testing you.
Right. And what I've heard is that, that now, given the fact that you have people who are perishing because of strokes and blood clots, or have perished because of that within the last month or two, nobody can go back and do that testing because they need the testing, which is in such short supply for people who are sick right now. And so we don't really have a good sense of how many people experienced this and died, and this was COVID related. I would love to bring in Dr. Prudence Pollard here, as we talked earlier. Claudia,
Carmela, from what Ursula has shared with us, what we do know is that African Americans are disproportionately affected by this disease.
Right.
Not only affected by this disease, but they're dying at a greater rate. I like to use the phrase, when others get a cold, African Americans catch pneumonia, and not only that, they die from it.
Yes.
Okay, there is something endemic, and I'd like to do a shout out to Dr. David Williams at Harvard, who unveiled this in his TED Talks on TEDMed. And he also did a shout out to what we're doing at Oakwood University to ensure that our population remains healthy. But others get a cold, we get pneumonia, and we die from it. So there's something endemic to our system as African Americans, regardless of where we originate from and where we live, that creates a certain reduced resiliency to diseases on our system. That is a fact.
Wow.
And education does not remove it. Socioeconomic factors do not explain it.
Wow.
Okay, so there is a problem, which is why, you know, and if you track the deaths from COVID as well as both the morbidity and the mortality rates, you're seeing a similar pattern that is associated with preventable health conditions, the comorbidities that disproportionately affect African Americans: obesity, hypertension, diabetes, cardiovascular disease, and cancer.
Wow. 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 This is
Similar
such good
rates.
stuff.
If you look at the data for COVID-19 and you look at the data for the comorbidities affecting African Americans, particularly those in Region 4, the southern states, where slavery was concentrated and was most onerous, there is something happening that is affecting us disproportionately. It's endemic.
Man,
go ahead, Claudia, because I'm about to be all over this. Go ahead.
No, I'm hyped. I don't know what you do. I'm hyped. Okay, these two guys lit over here in my room. Okay, wow, that is mind blowing. The thing that you guys are saying that's even coming to my own mind is my brother had COVID. So my brother works HR in a hospital in Southwest Michigan, but he had a fever and then he had back pain that he could not explain. He never had a cough, wasn't really experiencing a lot of fatigue. He was just randomly hot. And the only reason he even knew he had the fever is because my mom had a thermometer. And so he was, when I would call him or FaceTime him, he'd be like, yo, Claudia, this is the weirdest thing because I feel fine, but I know that I'm sick. The only thing that I feel is that if I'm laying down, it hurts to lay down. It hurts to sit down. Like I can't, like I have to be up moving and I know I'm contagious, so I can't go to work. And they would not give him a test because just like Miss Ursula was saying, he's not coughing. And so it's like, then I didn't think that I had it. But then I heard someone saying that if you ever experienced pounding headaches for an extended period of time, you more than likely had COVID. And there was literally about 3 to 4 days straight, I was just laying in my bed thinking I was going to die because my head was just, it's like somebody was taking a bat to my skull, just nonstop. And so I was like, well, I don't have COVID because I'm not coughing. I don't have a fever. I just have a headache. And so it's just so interesting because basically what you guys are saying is not only are the symptoms not what is being put out, you know, from the CDC, but as well as the system itself is not actually working to even think through, okay, what are additional symptoms that others could be experiencing? Because my thing is, if I or my brother died from COVID based on the symptoms that we had, why is it that you're waiting to do an autopsy in our body that you might not even do?
And they're not doing it.
And they're not doing it so that you can figure out if it's COVID. You know what I'm saying? Like they're not doing that kind of work. They're really just leaving it. And I think that it goes back to what Dr. Pollard was saying in the racial disparities and the racist history that Black people have attached to the medical system.
And here's the thing, Claudia, if I may say, and I want to hear Ursula's take on this. Remember, the mortality numbers are reported based on how the medical examiner coded that death.
Yeah.
If the person was not in the hospital being treated for COVID-19.
Correct.
Then they're not going to say they died of COVID-19.
What that means, there is underreporting. Ursula? It's yours to
Here's,
deal.
here's the take on it. We went back and looked at several patients that we found at home in their beds dead. As far back as January, we've been seeing this with no known reason. No, one lady, we were actually seeing the patient and not the daughter. The daughter came home from work saying she wasn't feeling well. And the next morning, when the staff went in to take care of the mother, found the daughter was dead. That patient later was diagnosed with COVID, but of course, the daughter's death was ruled off with something else. What's amazing is that I've spoken, because of my video, I've spoken with doctors from Australia, from doctors from Italy. And I think the most telling one was the doctor from Italy, which saying, do you see our numbers dropping, Miss Ursula? Italy's numbers are dropping because Italy has changed their tune. They've changed what they're looking for. They've changed how they're treating folks. Even if they can't bring you in, they're telling you, you know, they're giving you prophylactic treatment for possible clots, so that they're telling the folks what to look for, how to look for it, when to look for it. We haven't changed what we're telling you. You're hearing about clots, but it's very rare. There's no emphasis on it. Instead, here in America, our emphasis is on opening the economy, going back to work. And I guess that's what made me mad, because the narrative isn't right. Even if you look here in Maryland, they're talking about the seniors. When you look on the graph on the maryland.gov website, it's people between 20 and 50 that are dying.
Yeah.
It's not seniors.
Right.
We've got seniors who've had COVID, go to the hospital, and they're coming out. They're making it. It's that age group that it's just taking out, because we're not even being tested, we're not being treated, and nobody's addressing it.
Wow.
And that's what got me going, because I was like, wait a minute, this can't be. Why are we not saying anything? Why are we not hearing it revised to say, okay, this needs a different look, a different attention to what's going on. Whereas in Italy, they've done that.
Yeah. I want to get to some of the things that Italy and other places where the curve is flattening or the incidences and the reportings are being decreased in just a minute. But I have to acknowledge what you're saying, Dr. Pollard, and what you're saying, Ms. Roberts-Allen, there's two things here. I have to acknowledge the brokenness that I feel just hearing that this is affecting our people yet again, and in a disproportionate and deadly way. I have to sit in that space for a minute and recognize that something in me is very, very discouraged and disheartened to know that this is coming for our people. And what are you supposed to do with that? You know, this is coming for our people and nobody else is coming to help. You know what I mean? So what do you do with this as a public health concern or a public health phenomenon when you see that the system is broken for the reporting, broken for the testing, and so lopsided and skewed? How are you dealing with this from a public health perspective, Dr. Pollard? And then I'm coming back to Ursula.
As a public health practitioner, and I no longer I'm engaged in the direct practice in the general public health sphere, but at Oakwood University, we do have an internal community public health approach to the problems facing our people, because we are an HBCU. African American concerns are what we focus on. We decided 7 years ago to be agentic in addressing the problems facing our people. And it started with a conversation our president had with then former Surgeon General Regina Benjamin, if you remember her. And she said, she was leading a stop smoking initiative on campuses. And she said to our president, Mr. President of Oakwood University, you don't need to join this conversation. We know all about Oakwood University. You all have been smoke-free and vegetarian since 1896.
Sure.
Our president came back to campus and said, but are we a healthy campus? And I think that's the fact that each of us need to ask about our communities. We have been agentic. We were just on a nationwide podcast on last Thursday with the Partnership for a Healthier America and colleagues from the American Cancer Society and elsewhere, addressing and presenting what we're doing on our campus. If it's your church, if it's your school, if it's your home, if it is your neighborhood, address the issues. Okay? So whether it's too many liquor stores in our neighborhood or too many vape shops showing up in our neighborhoods, we need to address the problems that are contributing to the demise of the health status of African Americans. So we have to build healthy communities. So that's my first thing. But like Ursula is doing, we have to get the truth out. So not only do we have to build, but we have to share the information. I'm wondering how many churches this coming Saturday or this coming Sunday will actually have the honest conversations with their congregants and inform them about the possible death of a family member or the person who's sitting next to them. If it's 30%, now imagine you're sitting in a pew. To your right and to your left, one of those persons will die. That's the reality. So I think the gospel is summed up in 3 John, where John said to his friend Gaius, I wish above all things that thou mayest prosper and be in health as your soul prospers. Okay? So it's not just spiritual and trusting in God. It's also taking care of our God temples.
Wow. That is
and we
so
need
powerful.
to spread that message so we can take care of ourselves. We don't wait for the CDC to tell us the information. We don't wait for some head of country to tell us that we should take care of ourselves. We have to shout like Ursula is shouting, as organization, as Message Magazine is shouting.
Absolutely.
We have to provide information so our people know what's happening. They understand how to self-monitor. They know the resources that are available to them. They don't need anyone's permission.
Right.
Man, this is so powerful because I hear 2 things from what you're saying, Dr. Pollard. One thing I hear is the gospel right now is the health message.
Glory.
I did say it. The gospel right now is our health message. And so it's about time that we really zero in and share with people nutrition, exercise, water, temperance, right? Trust in God. There's so much that we need to be sharing with our communities. And I know we had Miss Donna Green Goodman come on a few episodes back, and she talked with us about nutrition and the importance of Black people choosing their own health. She really believes that this is an individual thing. But the thing that I also hear Dr. Pollard saying is that it's not just up to individuals to go out and eat right and exercise and drink water. This is a structural, systematic destruction and attack against Black people within the healthcare system. And so it's not enough for you to just wake up in the morning and eat the right foods, particularly if I live in a food desert and I have no access to that food. So at the same time, it's encouraging more Black people to get into the public health and the medical fields. It's encouraging people like Nurse Ursula Roberts Allen to start telling the truth and getting on their social media platforms and saying what's going on. Because the reality is, if we do not attack this thing systematically and structurally, and if all we keep doing is putting the burden back on individual Black people to be their own saviors, then we will continue to have the same amount of deaths, the same amount of destruction within our communities, because we cannot do it on our own if a system is actively built against us.
Precisely. And if we come with pre-existing conditions that have been developed across centuries.
Right.
Okay. So it means we're talking a virus in this situation. I'm just going to say, and you'll get to see our standout principles and our healthy campus in a little while. But this is not the time to say eat right. This is not the time to say if you eat right, you will avoid COVID-19. COVID-19 is a disease. It's a viral disease that also has bacterial implications. Okay, so this is not the time for that. What we're doing with health, and as you mentioned, the message of health, and I like that. Message Magazine, the message of health. I like that because that's what we're doing right now. We're sharing that message. When we talk about the laws of health or the principles that will help us to be healthy and resilient, we're talking about a future. Okay? Eating certain foods with antiviral properties right now will not protect me from COVID-19.
My Lord, please say that. Please say that again, Dr. Pollard.
Okay? And I hear people
speaking truth right now.
Yeah, people are telling folks in churches and wherever else, they need them. You need to eat this and you need to eat that. I heard somebody say you need to what? Is it drink bleach? Or whatever injected. So you get all of these crazy things going on out there. Along with this, we're saying for African Americans, let's build the most resilient body system we can. There are some things we can't change. There's some things we can't change, but we can manage it so that our quality of life is good. So if you have type 2 diabetes, you probably are genetically predisposed to type 2 diabetes.
Right.
Okay? Right. So somebody telling you, well, you need to do so-and-so. Really? Okay, yeah, I'll do that. It will help manage it. It will not cure it.
Right.
It might reverse it as long as I'm practicing those things. But remember, I'm genetically predisposed. Go ahead, Ursula.
Dr. Howard, I want to propose that one of the greatest stumbling blocks that we as Blacks have is that we're sitting waiting for somebody else to do it for us. And we really have to take the bull by the horns and realize this is our life. And we need to take control of it. We need to learn and educate ourselves and just not wait for somebody else to tell you. It's time that we start studying and understanding for ourselves. Sister White talks about the health message being the right arm of the gospel. God has given us and put us here for such a time like this. Nobody else is going to take this message, this gospel out there like we can. And so because it's affecting us, because we're the ones that are suffering the most, it's time for us to stand up and be that light that God's called us to do. And we're doing it by spreading the health message. He wants us to do that. And he knows that it's time to get your attention. He's tried many other ways. Nothing isn't working. So this time, this is about you. This is about each of us as individuals, but also collectively as communities of churches, of organization. What are you doing to help affect this change?
Now, here's the issue. In addition to what you all are saying, and the conundrum that I find myself in with respect, especially to this COVID-19 discussion and the different expressions of the disease within the Black community, is this. Just as you said in that video, that Black people are presenting with malaise and fatigue. Mm-hmm. And to me, that was cruel in and of itself, because we're not looking at an acute, alarming kind of symptom. We're looking at something that is chronic and so common among Black people who are working hard. We are tired sometimes. We have that malaise. We have that general sense of stress. And so the cruelty is that this indeed was a symptom of something much deeper. And so what I'm hearing you say is that we have got to come back to the point where we are rewinding the clock and redefining what does it mean to feel good and to be in health.
Wow. Very good.
That's right. Good. No longer are we accepting that I'm tired because I'm tired. I got 2 jobs, or I'm working around the clock, or I'm commuting, or I've got these other stressors, and that's just the way it is. That is not healthy. And this is not the time to address that.
Camilla, here's the thing. Here's the thing, Camilla.
Go ahead, Ursula.
The time frame between you feeling just not well and you going into that critical state where your life is minutes away is a short span, because that blood clot is developing. It's growing. With each pass of your blood flow, that clot is getting bigger. And yes, initially you feel, oh, I'm just a little winded. But the time between feeling a little winded and can't breathe is so short. And by the time you get to the hospital, if they have to put you on a ventilator, but your lungs are already filled with clots, there's nothing they could do.
Ursula,
so we've got to be more aware of these things. Yeah.
Yeah, my cousin, who was on the front line, and I say was, died early May. He was a nurse. He contracted COVID-19, did not know he contracted it, was feeling exactly the way you described for about a couple of days. The night he went to the ER, it was because he couldn't breathe. They admitted him that night. He was placed on a ventilator. By early morning, he was placed on a dialysis machine. He died an hour after being placed on the dialysis machine.
And what the Italians are saying, the minute you hit their ER, they don't worry about your breathing so much. They start worrying about your blood and thinning it. So they're using anticoagulant therapy immediately, and they're getting better results and saving more lives. That's what's different. That's what's different.
And that's the knowledge, that's the etiology of the disease. We know some things about the disease, and we know how it affects certain groups in the population. We know how it affects children. We know how it affects adolescents. We know about how it affects people with underlying issues, the comorbidities that we have been talking about. We know this. So why is the treatment so generalized? When an African American walks in, the immediate thing would be, this is a person likely to die.
Yes.
So therefore, I treat this person in a death prevention mode.
And that's happening even with people who has no underlying symptoms. And that's why you see that age group between 30 and 50 dying. Because they're busy looking to see if you were on drugs or you have all these other things, and you're telling them, I don't feel good. And so because you don't have any real symptoms, you're being placed in a waiting room somewhere to sit, when in actuality, your clock is ticking and you really don't have that time.
All right, let me ask you this. let's break this down for our people. We got people watching live, and I hope that people who are watching are sharing this, because this is good information, just like what you shared before. Talk to me, number one, about the symptoms that I am experiencing. We talked about malaise and fatigue. How can you gauge that, so that we know that this is something that is unusual to what I usually feel? What are some of the other symptoms that let me know that it's time for me to get help? Then the second part of that is, how do we advocate for ourselves when we go into the facility, to the hospital or the urgent care or the doctor? How do we insist, hey, look, I know this may not seem like much to you, but, so help me with that, Ursula, please.
I will tell you what folks are telling me they've done and had good results. One lady said, she said, listen, I took my phone in with your picture, with your video, and I'm telling them, no, this is what the nurse said, and this is what I have. These days, because our doctors are so overwhelmed, you've got to tell them what you know.
Okay.
One, you don't usually have that kind of pain. Even if you usually have joint and back pain, this pain that folks describe for COVID-19 is an intense muscle pain, a pain like you've never had before. You heard Carmela talk about her headache. That's not a normal headache. And we as Blacks, we've got to talk up for ourselves. Don't wait for them to diagnose you. Because the truth be told, in our culture, in our healthcare system, when you're going into your doctors, you have got to have already done your research. So you go in and you tell them what you're feeling and what you think it is. Because otherwise than that, they're just on to the next person. And so we have to be able to speak intelligently about our symptoms. You have to know what the symptomology is, and you have to do your part to advocate for yourself. And if it's too late because you're barely breathing, then you've got somebody there to advocate for you. And that's where we're really running into problems, because you can't get into the hospital. So if you wait that long, then you're going into the hospital and you don't have anybody to speak for you.
And I think to add to that, we typically don't have the experience, the majority of our population, with taking ownership for our own health. We go into our physician's office, or our nurse practitioner's office, and we say, here's what I'm feeling. And they say, oh, okay. It could be the blood pressure may be high, or whatever we're feeling, right? We say, I'm not feeling okay today. Okay? Our healthcare provider then runs a couple of tests. They take our blood pressure, whatever great healthcare people like Ursula will do. But we are not bringing to that interview a record of what we've been experiencing. Write down every symptom. Take that list, write down the duration, write down how long you've been experiencing this. Take it, and then here's a statement you have to
own your narrative.
Healthcare. Here's a statement. I have never felt like this before.
Correct.
This is not normal for this body.
Okay.
And it's the same thing, even your blood pressure. Ursula will tell you, some people, you're comparing to your history.
Right. And not just a class.
That's right.
Don't drop me in a class. This is how I'm feeling, and I know this is not normal for me. Yes. In essence, we've got to own our narrative. We've got to own our health history, and we've got to own the treatment. Don't relinquish your care to the doctor. You need to call the shots, which means you've got to educate yourself so that when you go in, you can talk for yourself.
That's right.
All right, now I'm gonna turn this whole thing over and around, and you guys might be mad at me because you kind of already said, Dr. Pollard, that this is not the time to, try to eat right if you haven't been doing
You
so.
gotta eat right. This is still the
not,
time.
I'm also a registered dietitian, so let's go there.
So you want, okay, what I'm hearing you say, or the way that we're trying to frame it now, is that let's build up, like you said, the body. Let's build up this temple. Make sure that we are going into any situation. So it's the COVID crisis now, but it can be something later on. Let's build up this body portfolio right now with all the healthy things that we can do. Now, and the reason I'm saying this right now is I heard an interesting story yesterday we had in worship for where I work, and the man was sharing about how he went to the hospital. He went there to the emergency room, sat in the emergency room for 4 hours. Certainly he had, they tested him and he was positive. They sent him home. He came back a few days later. He was short of breath. They gave him some oxygen, and he was breathing well through the oxygen. But the doctor said, "You're not as serious as some of the other patients that I have. And so I'm going to discharge you, send you home. I want you to go home, rest, do everything you need to do." The patient advocated for himself, and he said, "I don't feel well. I don't think you should be discharging me." And the doctor pulled him aside and said, "Look, if we put you on a ventilator, I have to be honest with you, it doesn't look so good. It doesn't look so good." And so it is, sort of a catch-22. It's like we do believe, on one hand, I need the medical care, but then we also see a medical system that is still learning this. And I believe that because God is the one that brings the healing, there's got to be some sweet spot in there. Am I right? So Ursula, when you say, when you're feeling bad, don't go home and lay down, but that is what I feel like I should be doing. So help me to navigate what I need to do, right?
We've got to think about it. If your blood is clotting, and you lay down, it's going to clot faster.
Okay.
You got to get moving. You got to help your blood using nutrition, because there's some natural blood thinners in our food supply. You've got all your green leafy vegetables. You've got garlic and onion and lemon, celery, kale. We can do, in years gone by, our forefathers didn't go to no doctors. They treated themselves at home. And so we've got to also take on the initiative to know, okay, fine, we can do these things. We can also self-monitor. A pulse oximeter on Amazon is $20. So if I buy a pulse oximeter and I can check myself, am I oxygenating well enough that I could keep trying these natural, or is my oxygen level dropping this fast that I need to call my doctor and say, what else can I take from a medical standpoint to help me with oxygenating my body? So those are things we can do. We spend $20 easy. A pulse ox, a thermometer. We need to be able to self-monitor. We need to be able to self-treat. Don't wait until you're critical. Start early and avoid getting to the place where they have to put you on a ventilator. And dialysis, that's like really bad. So you don't want to go there.
All right. So what I'm hearing you say is do everything.
But be cautious. Be cautious. If you have a pre-existing condition,
call your doctor.
You're taking medication for that condition. Please do not accept the home remedies your friends may be telling you to use.
Okay.
Right.
You could create a severe reaction that allows your underlying condition to now be uncontrolled.
Okay.
Okay.
And I'll give you an example of that. One lady called me and she said she's been drinking lemon and garlic and something else cayenne pepper.
Yeah.
And now she's got this feeling in her stomach that she's dying. I said, do you think that you just irritated your pre-ulcer stomach by putting all this heat in it? Acid, acid, acid. And so we want you to be wise. Even in the old days, our grandparents,
No.
they took a little glass of something and they mixed it with proper diet and balanced nutrition.
Right.
Anything in excess is going to hurt us.
Exactly.
So you want to be more cautious, but you want to go back and take the time to read how these natural remedies are supposed to be used. It's out there. And you can get it from reputable sources. So there's no reason to go off half-cock and do crazy things.
Okay.
And a lot of the sources are natural. You think about what sunlight gives you in terms of vitamin D and the stomach health that you receive from having adequate amounts of vitamin D. For African Americans, we can't accept the same prescription as for our lighter skinned brothers and sisters.
Correct.
Okay? So for us, it's not 10 minutes outdoors in the sunlight to get our adequate supply of vitamin D. It's 20 minutes.
Yeah. Okay.
And the darker our skin, the longer we need to be out there to get our vitamin D. So why do I need to pop a pill if I can be outdoors in the sunlight, exercising, so I'm getting fresh air, my lungs are getting the fresh air because the trees are processing that, cleaning the air for me. So the natural remedies that we're pushing first and foremost are those 8 natural remedies that does not discriminate on the basis of your wealth.
All right, come on, bring it.
The reason that is critical because as African Americans, our wealth is not the same as others.
Right. Right.
We have 6 cents for every dollar that a white person has. We have 6 cents.
You're talking good, Dr. Pollard.
Okay, that's not wealth for us.
Right.
So we need rather than spending $100 a month on pills to get my vitamin D and my vitamin C and whatever, let me figure out how to get it in the cheapest way possible because I still have rent to pay.
Yes.
Right.
Okay.
So what this is really good, guys. What I hear from Dr. Pollard and Nurse Roberts-Allen is that this thing is extremely layered. So neither of you are trying to prescribe any kind of one Band-Aid, everybody on here go home and take a walk. That is not what they are saying. Okay. This thing is so layered that they're saying, hey, the 8 natural laws of health are our first line of defense. So let's make sure that we're going outside. Let's make sure we're eating right. I know you guys were talking about this. Nurse Roberts-Allen was talking about the kind of natural remedy shots. I know at Mom's, you can get, little shots of zinc or little shots of elderberry. And if you don't have a Mom's because you might be in the South or in a poor area, you can order that off of Amazon Prime. So you don't necessarily have to be in your house grinding up garlic, throwing in orange peels and figuring out in this big old pot your own remedy, right? So there's that. But what I also hear you guys saying as well is, do not use this time as a moment to just completely get off of just stop all medication, right? If you have high blood pressure medication, take your high blood pressure medication, right? Do not allow your pre-existing conditions to become uncontrolled. And if you do get to the point where you are feeling so bad that you really do need to go into the ER or to any kind of nurse practitioner's office, private care physician, any kind of medical attention, go in there having noted these are all of my symptoms. These are how long I have been experiencing these symptoms. And then when you go in there, do not allow the doctors to send you home if you are really feeling that bad, because more than likely you might have a blood clot forming, and you going back home is not going to help with that.
Right.
So in essence, what I feel like these epic women are saying is to be aware of all of the potential levels that your body could be experiencing and could be at, and act accordingly. So that if you are to the point where you are at the doctor's office, advocate for yourself. Tell them who you are, what you have, and that this is something you have never, ever experienced before. Ladies, I tried to give the synoptic gospel of it. Did I leave anything out?
You got it. Own your narrative.
You got
Own your narrative. That is it. Guys, these are some phenomenal women that are doing phenomenal work. And so we want to encourage you. Nurse Roberts Allen actually works with the Allegheny East Conference Youth and Children's Ministries, and she would like to encourage any of you, if you are looking for resources for your children, spiritual resources, and any other kind of resources as well, be sure to visit www.aec.org. That is a great place for you to just continue to help your kids grow spiritually and in every other way possible during this coronavirus. We also have Dr. Prudence Pollard, as we spoke about, who is a vice president and professor at the Oakwood University in Huntsville, Alabama. And they actually have an initiative called the Healthy Campus Initiative. And so she would like you to visit www.oakwood.edu/healthy campus. And on there, you can see all the initiatives that they are doing, things that if you work at an institution, if you work at an education institution, or if you are even the CEO of another company, these are things that you can bring to your establishment, your organization, your entity, your business. We just really want to encourage everyone to be aware, to be cautious, and to be an advocate of not only others, but yourself. So many times as Black people, we fight for the rights and the well-being of other people to the neglect of ourselves. And this is a really awesome time, not just for you to make sure that your business is healthy, that your family is healthy, that your community is healthy, but this is also a time for you to take a step back, do some self-reflection, and make sure that you are at your best right now. So in the same way that you're advocating for everybody else, take the time to advocate for yourself. You are no good to your family, to your spouse, to your children, to your church, your community, your anybody, if you are not good. So please be aware of what you're experiencing. Be aware how your body is reacting to this quarantine and COVID-19 time, and make sure that you advocate for yourself if you ever have to go into a hospital. Okay. This has been another awesome edition of What's the Message. Make sure that you are subscribed to Message Magazine so that you can get our bi-monthly magazine as well as our weekly newsletter. Be sure to visit www.messagemagazine.com. And as well as you can follow us on Facebook, Instagram, and Twitter at Message1898. I'm telling you, the episodes are going to keep coming. The topics just might be different, but we promise to make sure that you are informed, equipped, and inspired to continue to do what you believe God has called you to do. All right. Thank you so much for being with us. Share this. This is probably one of the most important episodes we've done during quarantine. Share this with somebody else so that we all can become enlightened and educated about the symptoms that we are experiencing in this moment. Be blessed.